So if we look at the anterior compartment of the arm, then there are three muscles that I want you to be aware of in the anterior compartment. These are coracobrachialis, brachialis, and biceps brachii. If we start off with coracobrachialis, then this is a relatively short muscle. As its name suggests, coracobrachialis, it's running from the coracoid process of the scapula. Again, this is why those bony landmarks on the scapula were important, to the shaft of the humerus. And here we can see we've got coracobrachialis running from the coracoid process of the scapula to the middle third of the humerus. It's supplied by the musculocutaneous nerve. The musculocutaneous nerve that was coming from the brachial plexus. This muscle doesn't cross the elbow joint. It just crosses the glenohumeral joint. And because it does that, it flexes and also adducts this joint. If we go back and look at biceps brachii, we can see on this picture, we can see biceps brachii has two heads, as its name suggests. We have a short head that is running up towards the coracoid process, and we also have a long head that is running up towards the supraglenoid tubercle, that tubercle above the glenoid cavity. The tendon of the long head actually takes quite a long journey. It passes up within the intertubercular groove. The intertubercular groove formed by the greater and lesser tubercles of the humerus. So here we see the long head of biceps passing to the supraglenoid tubercle by passing through the intertubercular groove. The short head here attaches to the coracoid process. Here we can see the biceps, which is running within the anterior compartment of the arm, the muscle belly of biceps, and we can see that its main attachment is onto the radius, the radial tuberosity, which we can see here. It also gives rise to the bicipital aponeurosis, and that blends with the brachial fascia. Another muscle here is brachialis, and this muscle, like biceps brachii, crosses over the elbow joint, but because it's originating from the mid-shaft of the humerus, it doesn't cross the shoulder joint, whereas here, biceps brachii does. Brachialis coming from the middle third of the shaft of the humerus, it passes all the way down onto the ulna, and we can see brachialis muscle here. This muscle is only going to act on the elbow joint. So if we look at biceps brachii, its long head, its short head, we can see it's originating from the supraglenoid tubercle or the coracoid process. It passes to the tuberosity of the radius, and it blends with the fascia of the forearm via the bicipital aponeurosis, as that continuation of brachial fascia passes down into antebrachial fascia. It's innervated via the musculocutaneous nerve, and it has a whole range of functions. It's the chief supinator of the forearm. Because of its attachment onto the radius, contraction of biceps will actually supinate the forearm. So from this pronated or mid-prone position, the first movement of biceps will be to supinate the forearm. Once the forearm is supinated, continued contraction of biceps will then flex the elbow joint, but only once the forearm is in this supinated position will it then flex. Continued contraction of biceps, because it crosses the shoulder joint, can lead to flexion of the shoulder. Brachialis, as I mentioned, comes from the distal half of the humerus, and it attaches to the coronoid process and tuberosity of the ulna. It is also supplied by the musculocutaneous nerve, and it flexes the elbow joint. What you'll notice is that the muscles in the anterior compartment of the arm are all supplied by the same nerve, the muscular cutaneous nerve. That terminal branch coming from the lateral cord of the brachial plexus is giving rise to the musculocutaneous nerve that supplies the muscles in the anterior compartment of the forearm. So if we look at these in a bit more anatomical position, then actually to see these muscles, we need to remove deltoid. So on the slide at the moment, we've got a muscle here. We've got, an anterior view of the right arm with deltoid in position. We've also removed deltoid on this picture. And by removing deltoid, we can then see the position of the long head of biceps here. We can also see the short head of biceps here. The muscle belly of biceps is in place here, and we've removed it on this picture to see brachialis lying underneath. So hopefully you can appreciate that brachialis is sitting directly deep to biceps brachii muscle. It's very difficult to see brachialis muscle with biceps brachii still in place. Just see a small bit of it here and here. We can see we've got the bicipital aponeurosis passing down onto the antebrachial fascia of the forearm. So that we can see, if we look at these notes which we have here, that running over the intertubercular groove, we have what's known as the transverse humeral ligament, and that runs over the two tubercles on the head of the humerus, and this creates a tunnel for the long head to pass through. As I mentioned, distally, the two heads of biceps unite, and this continues down as the bicipital aponeurosis. Deep to biceps brachii is brachialis, and medial to biceps brachii is coracobrachialis, which we can see here. So we can see in these pictures all of the muscular put together into one anterior compartment of the arm. If we look at the neurovascular relations of the anterior compartment, then we can see in the diagram we've got our brachial plexus again. We can also see we've got some important blood vessels and their neighbouring nerves as they descend distally towards the elbow joint. So we can see the musculocutaneous nerve once again. We can see the median nerve. We can see the ulnar nerve. And these are running down this medial aspect of the arm. We can see them running all the way down the medial aspect. We can see actually here the medial intermuscular septum of the arm. And remember, that's separating the anterior compartment from the posterior compartment. Here we can pick up the auxiliary artery, but we can also see its relationship to the brachial plexus. And then as it runs down, it becomes the brachial artery. And we can see the brachial artery is running in a groove between biceps brachii and brachialis muscle. So here we've got biceps, and deep to biceps, we've got brachialis muscle just here. And in the groove between, we can see the brachial artery. We can also observe, if we go towards the anterior aspect of the elbow, the bicipital tendon, which we can see here, and that is forming a roof over the brachial artery and the median nerve. So the brachial artery and the median nerve are running underneath the bicipital aponeurosis and the biceps tendon. And this is the cubital fossa, and we'll cover that in future slides.